Okay, hi everyone. This is our lecture on chapter one, wait, let me just double check that I'm actually recording. I am. Okay, so our lecture on chapter one, which is really just an introduction to some basics of pathophysiology, as the title says, but also an introduction to sort of how the textbook is structured. Like I mentioned in our Zoom meeting, I do recommend that you do purchase the textbook, whether it's an electronic version or a hard copy. I think it's useful and I think it's well written. And there are going to be some topics that we're not able to cover through this semester, and so there's extra information there if you want to take a look at it. All right, so just to start our um, lecture here. So in terms of the learning outcomes that we hope to achieve in this chapter, define the conceptual basis for and the language used in the study of pathophysiology. So really just not all the language used in pathophysiology, but it just some main terms. Characteristics of risk factors that are associated with health and illness. We'll talk a little bit about those. So again, remember this is an introduction and sort of just talking about some broader concepts that really are going to be applied to sort of everything that we talk about throughout the semester. And then also outline the structure of the textbook, like I said, right, in terms of how each chapter is broken down, right? So the pathogenesis and the etiology of a disease, the clinical manifestations of disorders, how pathophysiology is linked to diagnosis and treatment, and then talking about the impact of things like genetics and nutrition, and lifespan on health and illness. Okay. Also, we'll talk or sort of talk about what epidemiology is, and then outline some of the sort of leading indicators of morbidity and mortality in the United States. I mean, we're not going to talk about any of this stuff extensively. It's really just an introduction to these topics. And then the last section or the last part of this chapter talks about evidence-based practice. And so this is something that I'll sort of bring in outside of the textbook throughout the semester in the form of reading research articles or journal articles, right? Or primary literature. And we'll talk a little bit more about that as we move on. The first journal article or research article that we have, we'll kind of do it together. Okay, so this is something that we'll sort of touch on more and more as we move through the semester. Okay, so the first learning outcome, define the conceptual basis for and the language used in the study of pathophysiology. Again, these are just some talking about broad concepts in physiology, and again, just some basic language. Okay, again, in no means are we covering everything here. Okay, so first we got to talk about the definition of pathophysiology. Okay, so what is it? It is the study of functional alterations, right, at the molecular, the cellular, the tissue, and the organ system level, okay, that are involved in disease states. And so depending on what disease we're talking about, we may focus more on molecular versus cellular, right? It kind of depends on what disease we're talking about, but we will consider all of these different levels, okay? So for me, for my background, I'm a scientist, particularly focusing on molecular and cellular types of research, right? So maybe we talk a little bit more about this. Maybe the textbook brings up more of tissue and organ system sort of levels, but we'll also talk about molecular and cellular, okay? And so again, the idea is that if we can understand the underlying mechanisms that cause disease on all of these levels, we can better treat that patient, okay? Pathophysiology also, it involves the study of how one organ system impacts the function of others, okay? None of the organ systems in our body act alone, right? They are going to impact other systems as well. So if we talk about disease, most often there are multi-system symptoms, right? Says here, I think I kind of already said this, understanding the functional alterations in disease states is the basis for understanding the mechanisms, okay? So we have to understand the why, okay? And so pathophysiology says it's important to understand the why rather than just the what, right? So if you're talking about hypertension, it's high blood pressure. Well, why? What's causing it, right? Or what are some factors that can cause it? Because that's something that can be caused by many different things, okay? A related term, pathology, or related sort of discipline. Pathology is a medical discipline, okay? Pathology particularly focuses on structural alterations in tissues and organs, okay? It is closely related to pathophysiology. This is where if we're talking about, again, a patient coming in describing a certain set of symptoms, there may be the need to take some sort of specimen, right? Maybe take a tissue sample or a blood sample or a urine sample. Okay, and then basically looking at that tissue sample to see what's wrong, right? To find those structural alterations, right? So that's what pathologists do. Also, another sort of subdivision of actually pathology is histology, okay? So this is really the microscopic study of the anatomy of cells and tissues, right? So you get that patient sample like I sort of just mentioned, and you can either take that patient sample, right, a piece of tissue directly from that patient, or look at patient cells and tissue culture. And basically you can use specialized stains to identify certain cell types, also to study how those cells are organized, look at the intracellular contents of the cells, and you can then look for abnormalities from there. Again, depending on what type of disease you're talking about, you're going to particularly maybe focus on one certain cell type. So you have to have techniques to be able to identify that specific cell type. Okay, so here we're looking at the small intestine, right? And these villi and the microvilli. And so, I think I sort of picked this because I have celiac disease, right? And so in order to, sort of be a diagnosis, to be confirmed as having celiac disease, one of the things that we need to happen is basically to have an endoscope, right? And to actually visualize these villi and to see if they're destroyed, right? And so again, there are many, basically any disease is going to has some sort of cellular impact, right? That then impacts tissues, that then impacts organs, that then impacts organ systems. Okay, so important to understand the basic cellular function, or what's going on, or what's going wrong with the basic cellular function, in order to understand disease and to really be able to treat it properly. All right, so that's why we study pathophysiology in a nursing program, or as a biology major. Okay. All right, so the next part of this is it basically titled The Conceptual Basis of Pathophysiology. And so I think it's nice to kind of think about it in this way. And so this is kind of the approach, I guess, that the book takes. Okay, so I got a couple things going on here. So if we look over here, it says fundamental principles of all physiologic mechanisms, right? So these are these sort of primary concepts, right, that we're referring to. And there actually is a table in your textbook. It's table 1.1. It's on page 5 and on page 6 that outlines these. They, on the left-hand side of the table, they call it biophysiologic concepts, right? These sort of primary concepts, and then relates them to these sub-concepts down here, and then also gives you examples of conditions that are related to these concepts, okay? So again, it's just a kind of a nice way of sort of organizing and also seeing how you essentially have different organ systems that are affected from certain diseases or affected by certain diseases. 1 second, I'm going to just get out of this and I'm going to see if I can pull up that table for you real quick. If it ends up taking too long, then I won't. But I believe I can. I sort of have it quickly set up here, I think. So this is the e-text of the textbook here. And here it is, right? And so this is the table that I was just mentioning, okay? I actually have a PDF of this in Moodle, and I think it says that in the PowerPoint, but this is a much neater way of looking at it, so I figured I'd show you if you don't have the textbook just yet. But again, this is the sort of main concept, right? These biophysiologic concepts. Here's a sub-concept related to it, right? And some examples of diseases that are related to these concepts, essentially, okay? And so you can kind of take a look, down this list here. And again, showing you sort of interplay between different systems, right? And, if you pick a certain disease here, you can see what concepts and what sub-concepts are involved, okay? So by no means do we need to memorize this or anything like that, but I think it's nice to kind of look at it in this way, okay? Again, if we I guess look at the top here, biophysiological concept is acid-base balance, okay? The sub-concept, excretion. So again, we're talking about function of the kidneys here. And there are many sort of mechanisms that contribute to acid-base balance, okay? If we talk about disease conditions, so metabolic acidosis or alkalosis, so this is meaning the pH of your blood is basically either decreased, right, lower or higher than it should be. And again, this can be caused by metabolic reasons, but also by because of respiratory reasons as well. Okay, so these are things that we're going to talk about as we move through this semester. But again, the whole point of this table is to show this sort of relationship of these main concepts and the sub concepts that will affect it. Okay, so here, cellular regulation, that's a pretty broad concept, right? Showing you sub-concept here, cell differentiation, cell growth. So if we're talking about cells that are going to grow out of control, we think about cancer probably, right? With formation of tumors, things like that. We think about cell growth. We might think about tissue and wound healing, right? You need cells to proliferate and make more of themselves in order to heal a wound, okay? And cell differentiation is actually the specialization of a cell, right? So thinking of like a stem cell versus a specific neuron, right? A brain cell, okay? And so if you have problems with cells differentiating into the cell they're supposed to be, it again, that's usually associated with cancer or overgrowth of a certain tissue or something like that. Because of sort of this misregulation of the cell. Okay, so again, you can kind of take a look at all these different sort of main concepts and the sub concepts that are related to them. Okay, so like I said, this table's on table 1.1. Nobody's going to memorize it, but again, meant to sort of be an overview. Okay, so let me go back to our PowerPoint here. And like I said, there also is a PDF that's available in a folder on Moodle as well. It's just not as nice looking as that. Oh wait, you know what? Let me just make sure, sorry. Let me just make sure I scroll through all of these so that you guys can take a look at everything that's here if you want to look at it this way instead of looking at it through that PDF. Okay, so you can pause whenever you would want and look at everything. So there's quite a few, right, of these concepts and sub-concepts that are listed in this table. A lot. All right? Okay, so let me move on. I just wanted to make sure I showed you that. Okay, so it says here, again, these fundamental principles, as you could see from that table, oxygenation was one of those primary concepts, perfusion, tissue integrity. You need to understand, right, these concepts in order to really understand different disease states, because again, you have a lot of interplay between these different concepts, okay? So again, I showed you those sub-concepts. So if you think about like disease states, right, like a heart attack, right, or a pressure ulcer, there's going to be these are going to be related to some of these primary concepts as well. All right, so this is an example here. So it mentions here pressure ulcers, right? So this is just showing you a picture of what a pressure ulcer is. It's a bed sore, right? So if we think about, so this is the sort of idea, right? So as a nurse or as another type of clinician, we know that we have to make sure we move patients around, that they can't lay in one spot in the bed. And then you think about the why, right? So we understand and this has to do with tissue integrity, right? And perfusion and oxygenation, okay, in terms of why these form, right? So we're thinking about the why when we think about certain things that we might do in the clinic. Okay, so that's the idea here. Again, now we're not worried about memorizing all the whys. We're going to learn about the whys as we move through the semester, but I think this chapter is really meant to set up for or really trying to make you understand, I don't want to use why again, but why we need to study pathophysiology, or why we need to know about the underlying mechanisms of disease, okay? Another example here, it says here, pharmacologic and clinical interventions are based on the primary concepts that underlie the pathogenic process, right? So for instance, for treatment of hypertension, one of the class of medications that are given, right, will decrease the strength of the contraction of the heart muscle, right? And so these are called calcium channel blockers. So the idea is this idea of, we're thinking about hypertension, high blood pressure. Well, if we decrease the strength of the heart contraction, right, and we alter perfusion, we then can treat high blood pressure. Okay, so these are kind of all of these things that, again, understanding these sort of primary concepts here and understanding, again, the why. So, right, so why do we prescribe calcium channel blockers to people that have high blood pressure, right? Okay, so to now kind of go along with that sort of heart attack example here, the book likes to, I'll just put this out here, there you'll see a lot of figures like this, okay, throughout the semester. And again, this is sort of based on that table that I just showed you. So as we move through and study, different specific systems, we'll see other examples like this, okay? So if you look at the title, concepts related to the pathogenesis of myocardial infarction, a heart attack, in an individual with diabetes, okay? So if we look up here again, all these concepts are feeding into the heart attack, right? So for instance, if we're saying the patient has diabetes, right? Diabetes is going to have effects on metabolism that actually can influence the thickness of the blood, okay? If the blood is thicker, there might be a chance that it may end up, essentially clogging an artery, right? Or obstructing blood flow. That blood flow is, if the blood is thinner, it's going to flow a lot easier, okay? If we think about up here, inflammation, okay, how is this related? So if we think about atherosclerosis, right, or the deposition of lipids in blood vessel walls, what happens is once those lipids start to sort of get stuck to the inside of that blood vessel wall, it triggers an inflammatory process. Okay, so then there's inflammation that ends up going there. And you know what? That then causes further constriction of the blood vessel. So you got some fat deposits or lipids that are stuck there. Then you have inflammation that's going to basically constrict that wall. You have thick blood. Well, there you go. That's all going to affect perfusion, right? Or blood flow. Okay. If blood flow is blocked in a given artery, what does that then affect? Oxygenation, right? And if a tissue, right, or heart tissue or heart cells do not receive oxygen, they no longer can function, leads to a heart attack. Okay, so like I said, you're going to see a lot of figures like this, and I think they're important if you really think about what they're showing, right? They're showing this interplay and how all of these things can affect this one disease state. Okay, that's why it's super important to educate patients, right, about the effects of diabetes. What also can they have effect on, right? I mean, they make you more likely to have a heart attack. Why? Because of some of the reasons we just mentioned. All right, so like I said, you'll see this a lot throughout the textbook. There's also, here's another one that the book goes through in terms of concepts that are related to an asthma attack, okay? And so things like obesity will actually lead to an increase in just overall in inflammation, okay? Inflammation of the airways, right? Again, can cause constriction. You have a decrease in oxygenation because now we're talking about the airways, right? And so we're not able to get as much oxygen to the blood from the lungs, and that then can lead to an asthma attack, okay? This is also then showing you here too, there are lots of asthma or asthma attacks that are triggered by environmental allergens. So that environmental allergen triggers an immune response, leads to increased inflammation, and then leads to an asthma attack. Also, genetics can influence this as well. Okay, so you can see again all of this interplay leading to this sort of one, if you're talking about, in the clinic, a person comes in with an asthma attack. Well, there's many factors that are influencing that asthma attack. And it's important to understand all of the interplay between them to be able to treat that patient properly. All right. So if we move on to the next learning outcome, describe characteristics of risk factors associated with health and illness. So what are some risk factors? Usually if we're in class, I ask you guys to tell me some risk factors. So I'm pretty sure we all can come up with a pretty long list of risk factors on our own, right? What are some risk factors that are going to make you more prone to disease, right? So you can think about that. And again, like I said, I'm sure you can name a whole bunch of them, and we'll talk a little bit more about them. If we're going to talk about those two terms, health and sort of health and wellness and illness, what does that really mean? Okay, so when we talk about health, we're saying absence of disease. Okay, absence of disease related functional changes. But it's best to sort of view health and illness as sort of a continuum. Okay, and so if we look at this diagram here, that's what this is showing you here. So here's sort of neutral health status. This on this side is more positive side, right? Increasing wellness until you're sort of ending with this sort of optimal amount of wellness. So you're doing all those things that you're supposed to be doing, right? You have a good awareness of basic health. You're choosing a healthy lifestyle, meaning you're eating healthy foods, you're exercising, what have you. That's going to put you towards this end, okay? If you're looking at kind of increasing illness or injury, maybe you're not making the best choices. You have kind of on this sort of I guess more milder side of illness, right? You have some signs of disability. Maybe now there's a minor disability, and then as you move towards increasing illness or injury, it's a major disability and then can lead to premature death. Okay, so you kind of think of sort of wellness and illness sort of as a graded type of continuum. It's not either you're healthy or not, okay? If we talk about what a disease is, right? It is a situation that impairs functional ability. Example, hypertension or high blood pressure. And as we sort of mentioned, there are many things that contribute to hypertension, okay? When we think about illness, right, that's when we're going to bring in the individual's subjective experience with the disease. So how does the individual feel, right? They may have hypertension, but how do they feel about it? Is it making them feel unwell? Okay, so the diseases you have, right, it's there, you have this functional impairment, but illness is really how does it make you then feel, right? So you can kind of think of the difference between, wellness and illness, okay? And because it's the subjective experience, it's obviously influenced by personal factors, okay? Personal factors that could be beliefs, knowledge, cultural factors, just overall general health. There's lots of other things that can influence this as well. And so, again, thinking about your role in the clinic, you have to be mindful of things like this. Okay, so this is kind of just giving you a little picture to the sort of examples here. So in panel A is a picture of an infant, okay, who has Down syndrome, right? He has a congenital heart defect that's connected with that Down syndrome that will be need to be corrected when he's 12 months old. Okay. If so, we're thinking about disease. So he has Down syndrome. That's a disease. If we take Yvonne Johnson here, these are just random names that are assigned to these people. And again, it's just giving you a sort of face to the name. Is a 35-year-old woman experiencing joint swelling, right? Pain, fatigue. The pain and the fatigue are beginning to affect her ability to work. So if we think about illness, she probably would tell you that she's ill, right? She feels really ill. Her family physician has not been able to identify the cause. Okay, so right now maybe she's not even diagnosed with the disease, but she is definitely has an illness. Okay, if we look at panel C here, Jacob is a 22-year-old college student who came to the emergency department after experiencing a sudden stabbing pain in his chest, right, with resulting shortness of breath. So that's a more acute type of illness, right? And we'll talk more about some of these situations as we move on, right? So there are some sort of questions to think about, right? And I kind of touched on some of these. So are these patients healthy or ill, right? How would you describe them? Number 2, are their conditions chronic or acute, right? And again, I sort of alluded to that. We think about Jacob's condition probably as being acute. Maybe we think about Yvonne Johnson's illness as being chronic, potentially, right? Same thing with Connor. What risk factors does each patient have that might shed some light on the patient's conditions? Obviously, we don't know about their history, but that would be something that you could find out if you took a patient history, right? We'll learn about those risk factors and maybe educate those patients to say, hey, let's think about, stopping smoking or what have you. Okay, so those are just some things to think about. So I think I'll touch on this, but we will have case studies. And if you look in the textbook, there are even case studies already in chapter 1. So there's always a couple case studies in each chapter that we sort of follow along. Okay, so we will be doing that throughout the semester as well. Just some more definitions here, right? So if we're talking about a disorder, okay, so this is disruption of physiologic or psychologic function, right? So it gives you an example of cellular dysregulation due to leukemia, okay? If we talk about a syndrome, we're talking about a group of signs and symptoms, okay? And so obviously these signs and symptoms will emerge from some sort of disease state, okay? So this gives an example, acute coronary syndrome, okay? There's many examples that you can think of, but obviously as clinicians, you're going to be trained to look for certain signs and symptoms, okay? Well, I guess you're looking for signs. The symptoms are subjective. So we're going to talk about that. Those are things that the patient needs to tell you about, right? So I mentioned risk factors, right? So what is a risk factor? Anything that increases the risk for disease, okay? Some sources of risk factors, genetics. That's a risk factor that you can't do anything about, right? Lifestyle factors like smoking, drinking, you don't exercise, right? Those are probably some things that you can do something about. Social determinants of health, okay, in terms of like access to healthcare and things like that. There are lots of things that fit under that category as well. So as I mentioned, there are some that can be changed. So we call those modifiable risk factors, right? Diet, smoking, how much you exercise, those are all modifiable. If we talk about non-modifiable, we're talking about genetics, right? We're talking about age, we're talking about race. You can't change those. Okay, so those are the terms there. So we want to just be familiar with modifiable versus non-modifiable. Okay, this next learning outcome talks is kind of focused more on the structure of the textbook, right? So what are the sort of sections that you're going to see in every chapter, okay? And so when we talk about presentation, when we introduce or when the book introduces a disorder, right, or a condition, we basically will always follow this sort of same structure here. Talk about the etiology and the pathogenesis of that disorder or that condition, the clinical manifestations of it, and then we'll try to link the pathophysiology to diagnosis and treatment. Okay, so it's sort of always broken down in that same way in every chapter. Okay, so let's talk about a little bit about what we mean by etiology. Okay, so what is that? That's the cause of a disease or the cause of an injury. Okay, and it can be, it could be one factor that's the cause. So if you think about, example, the common cold, it's caused by the rhinovirus, right? Or rhinovirus, that's the one factor. It can certainly be, and most times it is multifactorial, like hypertension. There are many different things that can cause hypertension or that contribute to hypertension. There's not one known cause, okay? If we talk about some different agents, right, that can cause disease, there can be exogenous, right, or external, right, from the external environment, things like chemicals, right? They can be physical agents, infectious agents. And so maybe you can, again, if we were in class, I'd say, give me some examples of some external etiologic agents, right? What are some examples of those? You can think about chemical agents, right? Like carbon monoxide, lead, things like that. If we think about, infectious agents, obviously we think a lot about infectious agents these days, right? Viruses, bacteria, fungi, right? If you think about physical agents, right? Temperature, radiation, right? Any other type of trauma, electricity, those are all examples of physical. If we talk about endogenous, right, we're talking about agents that are from within the body. So in terms of some examples, abnormal immune reactions, right, gene mutations, and I'm sure we probably can think of some other ones as well. So maybe take a second to think about some other endogenous types of etiologic agents that exist, right? I mean, you can even think of stress in that. I mean, I guess you can kind of think of stress as being both maybe an exogenous and an endogenous, right? There's probably something in the environment that elicited or activated some sort of stress response, but really that stress response is happening internally, and that's what then is going to affect or could contribute to disease. All right, some other terms down here. So idiopathic, right? If we talk about a disease being idiopathic, it means that the cause is undetermined. We don't know the cause. Unfortunately, there are very, very many diseases that we don't know the cause, okay? If we talk about iatrogenic, this is something that's actually caused unintentionally, right? So by like an error, a medical error. So like, or by a treatment that maybe, maybe it wasn't given by mistake, but maybe it was given, it was experimental, and it ended up actually causing another type of disease or something like that. Also, a diagnostic procedure to which there was a mistake made or something like that. So there are causes on that level as well. Okay, if we want to, again, just defining and kind of setting up, like I said before, these sort of broader topics and these sort of broad terms that are going to be applicable as we move through the semester. The term pathogenesis, right? We talk about the pathogenesis of disease, okay? The origin of the sequence of events to structural and or functional alterations in cells, tissues, or organs resulting in disease, okay? The underlying mechanisms responsible for the clinical manifestations of disease. So I mean, really, when we're talking about pathophysiology, we're going to be examining the pathogenesis of different diseases, okay? And talking about, as much as we know. There is an example that's given in the textbook of diarrhea associated with C. diff. You probably have heard of C. diff before. This is a specific pathogen, right? And it's a gram-positive bacteria, okay? And so the idea is that there are environmental factors and host factors, internal factors that are going to influence the sort of disease or the diarrhea that's associated with the infection, okay? So for instance, it says, one second. I think it's important to kind of give this example. So yeah, so if you have some alteration, right, in your microbiome, right? When we think about microbiome, if we want to just think about sort of, I mean, you can think about it within the entire body, right? There are resident bacteria, right? Certain populations of bacteria. If you're talking about in the stomach or in the intestines, there's a certain population of bacteria that exists there that are normal and that are good, right? And so if for some reason there are alterations in those resident bacteria, right? Maybe because you were taking an antibiotic or something like that, exposure to the C. diff may then lead to, a more serious case. Okay, so the idea is that you're exposed to this environmental sort of agent, right? This bacteria. And then you also have some sort of compromise within your body. And then that's what then is going to lead to the disease. Okay. So it's this sort of interplay, between a lot of different things. In this case, we're just giving the example of sort of that environmental exposure, and then that for whatever reason that alteration in your microbiome, that alteration in the bacterial population that should be there. Okay, so that's the example. You can read a little bit more about it. It's actually on page 10 in your textbook. Okay, if we talk about clinical manifestations, right? What does that mean? We're talking about signs and symptoms associated with disease. And I think, for you guys, if you're talking about being a clinician, right? Whether it's a nurse, whether it's a PA, you're gonna really focus a lot on signs and symptoms, right? Patient's gonna come to you and present with certain signs and symptoms, and then based on that, you're gonna, try to sort of make a diagnosis, right? It says here, related alterations in diagnostic tests, right? You're going to order some sort of diagnostic test, maybe a blood panel, and you're going to look at those numbers and see what that tells you, right? And then hopefully make a diagnosis from there. If we want to kind of, again, define some of these things, so a sign is an objective indication of a disease. So these are things that you as a clinician can measure yourself or observe yourself, right? Abnormal heart or lung sounds, a rash, a fever, okay? Those are objective. A symptom is subjective indication of a disease. The patient is telling you, I have pain in my chest. I have pain in my upper back between my, I don't know, between my two shoulder blades, right? I feel nauseous. Okay. I have shortness of breath, right? Or numbness. Those are symptoms. If we talk about syndrome, okay, it's a combination of signs and symptoms. And so that usually you have this sort of characteristic combination of signs and symptoms that would be characteristic of a particular disease. So if you think about AIDS, right, acquired immunodeficiency syndrome, there's a combination of signs and symptoms that go along with that syndrome. Okay. I mentioned some of this when we were talking about sort of those examples of those three patients, right? We saw the picture, the difference between acute versus chronic, right? So acute disease appears quickly, and hopefully a lot of times it resolves itself quickly as well. Chronic diseases are enduring and there's lasting implications. So maybe these are sort of have this slow, gradual onset, and they usually linger, unfortunately, for most of the patient's life, right? If we talk about exasperation and remission, during exasperation, we see an increase in disease severity. Remission, we see a decrease. So I always think about multiple sclerosis when I think about remission and exasperation, where you have these periods where you have a lot of symptoms, right? And then you go into remission, and again, you don't see as many of those symptoms. And that's true of a lot of different diseases. I always think of MS for some reason, because there's relapsing, remitting type of multiple sclerosis. So I always think about that when I see those two terms. Okay, so here, linking, so sorry. Right, we were all kind of under. So we first started. So we kind of first started talking about. Let's go back. How we're going to break down sort of each disease that we talk about. Right, the book is always going to talk about the etiology and the pathogenesis, then the clinical manifestations, and then we're going to try to link pathophysiology to diagnosis and treatment. Okay, so then we talked about some concepts and definitions within etiology and pathogenesis. Right. Okay, then we talked about clinical manifestations. And we talked about signs, symptoms, what a syndrome is. Okay, and now this last part is talking about linking pathophysiology to diagnosis and treatments. Okay, so you'll relate those pathophysiologic concepts that we sort of talked about a little bit in the beginning to diagnosis. I sort of alluded to that, right? If we're talking about different signs and symptoms, we order a certain, test, like a blood panel or something like that. And then we make a diagnosis, and then from there, develop a treatment strategy based on that diagnosis. Okay. So obviously the treatment strategy that you're going to recommend has a basis in the physiologic and the pathophysiologic mechanisms. Okay. And if you think back to that table that we talked about, right, think about those main concepts and those sub concepts that we talked about. Okay. You have to, sorry, if we go back to the treatment, right? Most treatments are going to try to alleviate the symptoms, right? The signs and the symptoms that we talked about. Most of the time, because we don't know the cause of a disease, we're not going to be able to give a treatment to cure that disease. Okay. All right. So anyway, we'll talk more about that. Just want to put that out there. Okay. The next part, again, is just kind of an introduction, because the next chapter, chapter 2, focuses on genetics and genomics. Okay, that's what that next chapter is going to focus on. Again, important to think about this, and for us, to have a knowledge of sort of basic genetics as a clinician. Okay, so if we want to, so these are kind of just 3 different sort of fields of study. I don't love how the book defines epigenetics, so I sort of added a little bit in here. And again, we'll talk more about this in chapter 2. This is just meant to kind of bring up these are factors, right, that will influence disease. Okay, so we're talking about it in a broader sense right now. So if we talk about genetics, we can think about more of the role of specific genes. Okay. And then inheritance of genetic variations of specific genes. So we think about sickle cell anemia, right? Inheriting that sickle cell disease, that sickle cell allele. Okay, so that's a specific mutation that then leads to a dysfunctional hemoglobin protein. Okay, so very specific. we talk about genomics, it's a little more larger scale. So it says mediation of physiologic function by groups of genes. Okay, so let's just think about groups of genes kind of together rather than one specific mutation in a single gene. All right. The last one that we mentioned, and again, like I said, we're going to talk about this more in the next chapter, is epigenetics. So it says all genetic variations or modifications that have influenced a particular cell. Okay. When you think about epigenetics, it really refers to inherited changes, right? So changes that you can still inherit to the DNA, right? Or other molecules that are directly related to the DNA, but they're not part of DNA sequence. So it means it's not a change in the DNA sequence, right? So if you think about, the sequence of a gene, right? And those nucleotides that make up the sequence, if you change that sequence, it's obviously going to alter the function of the gene. Well, epigenetics is not about a change in gene sequence, right? It's about changes that affect gene expression, okay? But again, some of these changes are actually inherited, can be inherited. And so obviously that will affect disease state, right? All right, in terms of nutrition, right? Again, this is going to be something that's going to influence disease. We think of it as a modifiable risk factor, right? Often described as a modifiable risk factor. I guess, again, if we were in class, I might ask you, well, can you think about how maybe some might not consider it as modifiable, right? I mean, could it be considered as non-modifiable or a risk factor that you can't modify? Says impacts risk for disease development, obviously. If you're talking about, and these are just some examples, right? High intake of carbohydrates and fat, maybe it makes you more apt or more inclined to develop diabetes, right? If we talk about high intake of sodium, can lead to cardiovascular disease or hypertension, right? High blood pressure. Okay, there's lots of other things that we could have added here. Those are just a couple examples. Okay. Now, next thing to kind of consider, again, these are all just main concepts that are going to influence or impact disease states or lead to a disease state. So things you also have to consider are lifespan considerations, right? What population are you talking about? Because there's certain diseases that are more prevalent in certain ages, right? Or certain generations or what have you. So we talk about pediatric population here, right? There are genetic variables that can significantly influence fetal development. Okay, and so it could then lead to congenital defects. Okay, congenital defects like this one that's sort of pictured below here, tetralogy of Fallot. Okay, where it's basically and I'll just show you here in the notes, I sort of added in the information for the 4 congenital defects that make up this disease here. Okay, so just if you're interested, but it was listed as an example, so I figured we probably should know kind of what it is, but it's just a congenital defect. So it's a rare condition that's caused by a combination of these 4 heart defects, and we don't really know what the cause is. Okay, sickle cell disease is also example here. So it says increased incidence and prevalence of certain diseases. Okay. You can kind of think about if you see that increased prevalence or incidence, what might be the reason, right? Other things to consider: pregnancy, right? There are lots of physiological changes that happen during pregnancy. There are certain conditions that really only happen during pregnancy, right? Like gestational diabetes, preeclampsia, okay? And so it's important to understand that if a woman is pregnant and has some of these other sort of risk factors that you would then, test for or be on the lookout for these types of diseases that are specific to pregnancy, okay? Also, if you think about older adults, right, there are age-related changes in physiology. There's long-term consequences of certain conditions that a patient might have had throughout their life. As they get older, there are going to be maybe more serious consequences that we need to be aware of, okay? And then obviously there are certain diseases that, again, primarily affect the older population, okay? All right, so that leads us, no, not to the last part. We have one more section after this. So here we talk a little bit about the study of epidemiology, okay? And just outline of some of these leading indicators of morbidity and mortality in the United States. So if we want to, again, define what does epidemiology mean and why do we talk about it in pathophysiology? Okay, so it's the study of how disease is distributed in populations, right? And then you try to identify factors that influence this distribution, right? So we can, think about, again, we only see a certain disease in a certain maybe geographic area, that then we can then study the impacts of environment or the climate or something like that on that disease state, maybe in certain demographic regions, right? Or so once you identify that the sort of distribution of that disease, you then can look at the factors in those certain areas, right? And see what might be causing it. Okay, so it's important to know about the distribution of it, right? It's important to know about the incidence and the prevalence of a certain disease. And then you can then examine the factors that might be causing that, okay? So it says here a number of new cases of a disease or a condition within a defined period for a defined population. So this is incidence. Incidence is the number of new cases of a disease. Prevalence is the number of individuals of a defined population who already have the disease, right? So the total who already have it is prevalence. If we talk about incidence, it's the number of new cases, okay? Epidemiology basically will report incidence and prevalence of a disease, okay? Now, there's a good example here as to why, it's important to think about epidemiology and the sort of distribution of disease, and why there are scientists that are, that are specifically focused on this area. And there's an example in type 2 diabetes in youth on page 14, okay? And basically, if we think about diabetes, right, we think about type 1 diabetes, we think that, kind of in general, we'll think that type 1 diabetes is caused by an autoimmune mediated destruction of the pancreatic beta cell, meaning there's something that's destroying those cells of the pancreas that normally produce insulin. Okay, and so your body doesn't have the ability to produce insulin, right? And usually we think about type 1 diabetes as being diagnosed early on in life. Okay, so it's more of a, again, whatever, yes, early on, right? Because it's more of an internal cause. Okay, there's an abnormal immune reaction that's destroying cells that normally produce insulin. If we think about type 2 diabetes, however, right, this is characterized by insulin resistance, right, and a relative decrease in insulin secretion from the cells. And we a lot of times will associate type 2 diabetes with obesity, right? And so normally type 2 diabetes is diagnosed later in life, okay? However, what basically kind of started happening, I guess, is we started to see a lot more cases of diabetes being diagnosed early on. And you might assume that that was type 1 diabetes, but when you looked at it more closely, right, it in fact was type 2 diabetes. And so this was kind of the, because we basically saw this sort of uptick in children that were obese, right, and then started to see type 2 diabetes developing much younger. And so careful sort of study or I'm not going to be able to say it, right? Epidemiological data allowed that sort of identification of what was happening, right? So I think that's a really good example. And I probably didn't do it complete justice, but you can read a little bit about that. And actually, I think cites some other literature that you could read up on, okay? But again, it illustrates the point as why it's important to think about epidemiology, okay? Super important. Okay, and so obviously, that's epidemiology. We probably think about public health, right? In general. And so what actually is public health? So the science of protecting and improving the health of families and communities, right? Through promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious diseases. Super important, right? Again, we're talking about it. We're in a huge public health crisis right now, okay? And again, you can see how epidemiology epidemiological data is super important if we think about overall public health. We need to know if there are certain areas where there's some disease that's much more prevalent. We need to know that that's there. Then we can investigate why it's happening. Okay. I also added a little question in here. Again, this is something I probably would ask you if we're in class. What is the role of a nurse or other medical professional in promoting public health? What do you think your role is? Are you responsible for promoting public health? And how would you do that, right? If you think about kind of day to day. A lot of this is in the way of patient education, right? Teach patients about healthy lifestyle, right? If we teach a whole community about healthy lifestyle, that's going to positively impact public health. Okay, so there's lots of things that you can kind of think of, I guess, in terms of how you might influence public health as a clinician. Okay, I did say we were mentioning a little bit about morbidity and mortality. So first, just to define, right? Mortality is the number of deaths in a given population. Morbidity is departure from physiologic or physiological well-being. And basically it encompasses disease, right? Injury or disability. So we're talking about morbidity. It's sort of the presence of disease or injury, or sort of the disability state. Mortality is actually death, usually caused by disease, right? So you think you can talk about mortality data, given certain diseases, okay? Or you can think about morbidity in terms of having that disease, right? So if you look at this table here, this is in the textbook as well, here we're talking about mortality, right? Number of deaths caused by heart disease, number of deaths caused by cancer. Not exactly a nice table to look at, right? Okay, but this is showing you mortality, not morbidity. If we're talking about morbidity, we're talking about the number of people that have heart disease, right? Just to kind of go a little bit further with this, there was there's an initiative, this Healthy People Initiative, or sort of a program that was set up by the U.S. Department of Health and Human Services. And basically what it was meant to do is basically set up a sort of 10-year or objectives, I guess, over 10 years for improving the health of people in the United States, right? So this is a bunch of, clinicians and scientists coming together to say, what are the sort of leading health indicators, right? So we're not talking about illness indicator, we're talking about health indicators. What do people need to be healthy, right? Access to health services, environmental quality, right? Maternal, infant, and child health. So think about this. If you think about areas of the country or areas of the world where you don't have these things, there's going to be an increase, in disease. Okay. And sometimes it's particular certain diseases, but we have to think about that. Okay. So these are all super important in terms of keeping that population healthy, right? Or increasing public health or maintaining public health. Okay. The last section of this talks about evidence-based practice. And as I said, I'm kind of going to bring this in throughout the semester. We're going to read some articles together. You're going to read some articles on your own. You're going to use evidence-based literature or journal articles or research articles in your final project. Okay, so if we talk about evidence-based practice, what does that mean, right? So this is just a sort of definition that was provided in 1996 by Dr. David Sackett. And so he said, the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of an individual patient, right? So you're integrating individual clinical expertise with the best available external clinical evidence from systematic research, okay? So the idea is that you need to be informed, right? You need to know, that's why it's important to read this primary literature that we're bringing in, because you need to be well informed. So if you're, working in the cardiac unit, you should know about what the best practices are, and you should know about what your colleagues are doing, so that that you're always using the sort of most up-to-date and effective ways of treating a patient. That's the idea, okay? I think I just said this, okay? It says here, practice decisions should be based on research studies that have been evaluated by using a set of consistent criteria, okay? Anything that's published in a journal, in a peer-reviewed journal, is exactly what it says. It means that other peers, right? Other doctors, other scientists have reviewed that work before it actually gets put out there. Okay, so it's not just anyone writes anything and puts it out there. It is extensively reviewed. Okay. All right. So here, evidence-based guidelines to evidence-based practice. Okay. So it's saying here, evidence-based findings compiled into practice guidelines. Those practice guidelines then form the basis for identifying healthcare procedures and techniques supported by clinical evidence. Obviously, this is kind of, I guess you kind of think of this, though, this isn't maybe necessarily something you do as an individual, but it's something maybe that, you know, the chair or the head of the, say, the emergency department does, right? And basically relays this information to the entire department, right? So we think about again, or something like that, right? So it's something that you're kind of doing as a sort of team type of activity. All right. So anyway, I mean, I guess you can kind of see this, right? This isn't something that like an individual nurse is probably going to do on her own, but this is something in the workplace that should really be provided. Okay. It says here, ignoring patient preferences and experience may lead to patient non-adherence due to conflicting goals or values. Yeah, that's important, right? It's important to think about and to talk to the patient. And then again, sort of tailor the practice based on that as well. Okay. All right. So anyway, this is just some kind of, I guess, some sort of examples here. Nobody, this is something that like you don't need to memorize. All right. And so that is the last slide here. I just want to see if I kind of missed anything. Delivered care respects patient values and preferences, right? So these are kind of all, both these down here go along the same line. So I guess you kind of think about it this way, right? If you think about this. So maybe just because there's some innovative technology that was developed, right? In terms of like, oh, we could all use this, treatment for, say, I don't know, traumatic brain injury or something like that, or I don't know, some other, anyway, it doesn't really matter, right? However, if that treatment is like, I don't know, so invasive that it's going to be super uncomfortable to the patient, and it will create maybe additional problems because of it, or the patient is totally against it. These are things that you need to consider before actually delivering it. I think that's the idea here, is to you need to be aware of the new research that's out there, but then you also have to think about the patient population as well, right? So maybe something too that's discovered that could be used in the treatment of cancer, maybe you can only use it in the pediatric population and you can't use it in the geriatric population. Okay, so again, you have to sort of consider that as well. So that's kind of what some of these things are getting at. All right, guys, so that ends chapter 1. Like I said, chapter 2 will be focused on genetics. Okay, the title of chapter 2 is genetics, genomics, and epigenomics. We touched on it a very little bit.